Your health and well-being and the health and well-being of your baby or your babies in the tummy is your responsibility. So you have to look out for these signs. Hi guys, welcome back to my channel. If this is your first time, I am Precious. On this channel, I help you understand that family relationship is a work in progress. Today's video, I'm going to be talking about 15 signs that you should not ignore when you're pregnant. Now, I am not a doctor. I'm just a mom of 3 kids who is pregnant with baby number 4, and I have so many apps and I read a lot, and these are a combination of different things that I've read from different apps and from my pregnancy notes that moms should not ignore when they are pregnant. You may go and read for yourself, you may go and do your research for yourself, and also ask your midwife or your doctor the things that you should not ignore. One of the things that I would like you to bear in mind is that when it comes to pregnancy and when it comes to your health, you are responsible for your health. The doctors, the nurses are only there to look after you based on what you have told them. So if you experience any of these symptoms and you don't tell them, they would never know that you've had any of these symptoms. So it is better you go and you speak to your midwife or your doctor and they tell you that everything is fine. You have that peace of mind that a professional has actually said everything is fine. Then you can go home and rest. But when you don't tell your professional, someone who is your healthcare professional who is looking after you, that you have these symptoms, they may not be able to help you. So what I'm just trying to say in essence is that your health and well-being and the health and well-being of your baby or your babies in the tummy is your responsibility. So you have to look out for these signs. The first sign that you should not ignore when you're pregnant is when you have pain in the middle of your tummy. When you experience pain in the middle of your tummy. There's so many things that can actually cause pain in the middle of your tummy. It might be indigestion, it might be heartburn, it might be so many other things that can cause pain in the middle of your tummy. But if you're in the second trimester, like from the app that I've gotten this information from, it might be that you have severe preeclampsia, which is very, very dangerous in pregnancy. When you're having pain in the middle of your tummy, please ring the pregnancy assessment unit, or you want to ring your GP or your midwife to tell them how you're feeling. Let them make that decision. All you're responsible for is telling them how you feel, and it's up to them to decide whatever they think the options they're going to take is. But at least you've done what you need to do. Another sign that you should not ignore is when you have pain in the lower tummy. Now, the first thing I talked about was pain in the upper part of the tummy. Now is pain in the lower part of your tummy, either the right hand side or the left hand side. It is very, very important that you let your health care professional know, because there are so many things that can cause that. Number one might be ectopic pregnancy. Ectopic pregnancy is very, very dangerous, like you know. So ring your healthcare professional and tell them the pain you're having, either on the right hand side or the left hand side. So pain in your lower part of your tummy, either on the right or on the left, when you are pregnant, please don't ignore. Another thing that you should not ignore is when you have a fever. Now, fever is a sign that your body is fighting something. So when you have a fever where your temperature has gone like over 39 degrees Celsius, you have to, as soon as possible, go to the hospital, because it means that your body is fighting an infection. The thing is that we don't know what the infection is unless you go to the hospital and get it checked. So when you have high temperature, when you have a fever, you need to let your healthcare professional know, because it's a sign that you should not ignore. It might be dangerous, or it might just be nothing, but it's good that you know that it's nothing from the professionals. Another sign that you should not ignore is when you have a blurry vision, or when you have like spots. You can see like spots in your vision. It's a sign that you should not ignore, especially if you're in your second half of your pregnancy. You're having this blurry vision, you're having this flashy light or spotty light when you look at something. I am not a hair professional, but this is something I'm going to be looking at for now that I'm pregnant, that I need to call the doctor as soon as possible. So when you start having that blurry vision, don't let anybody tell you that, oh, you know, when you're pregnant, you get really tired. It's true you get tired when you're pregnant, but you don't get blurry vision. You don't get to the point where your eyes, you're going really dizzy. So it's a sign that something is not right. So you may want to call your health professional as soon as possible. Another thing as well that you may want to bear in mind is, or a sign that you should not ignore, is when your hands and feet are swollen. I know that can be a sign of preeclampsia myself. So if I can know that, then you should also know that, because I am just an ordinary person like you are. I know that this is a sign of preeclampsia, and from the things I've read, it's a sign of preeclampsia. Please, if you have swollen hands and you have swollen feet, don't let anybody tell you that, oh, you need to go for a walk. It's because you've sat for a long time. That's why your feet are swollen. How about your hand? So as soon as you notice that your hands are swollen, your fingers are so swollen that you can clearly see that your fingers are swollen. Now, when a woman is pregnant, most of the time her hands, her fingers are swollen. But when it becomes abnormal, you would know as a person that this is not normal anymore. So call your health professional and get it checked. Let's just have that peace of mind that everything is fine with you, because that's what I want for you. Another thing as well that you may want to look out for is when you have this headache. You know this headache that you have, that when you take paracetamol, it doesn't go away. When you go for have a good sleep, or when you have a good rest, it still doesn't go away. Straight to the doctor as soon as possible. Go straight to see the doctor. That may be a sign that you should not ignore. Like I've always said, go, let them tell you that everything is fine. Then at least you've done your best. So another sign that you should not ignore is when your legs, you have pain in your legs and it feels very tender and swollen. That could be a sign that you have blood clots in your leg. Someone like me that don't have any medical, I'm not a doctor, I'm not a midwife. As soon as I find out that my leg is swollen, the first thing that will come to my mind is, what is going on? I need to get it checked. So if you find that your legs are swollen, your legs are painful, the sign can be that you have blood clots. And blood clots is a very, very dangerous thing, because if it moves from your leg and goes to your heart, that might cause heart problem for you. So as soon as you find out that your legs all of a sudden becomes really painful and swollen, know that you are having a problem that you should not ignore. So you need to speak to the doctor as soon as possible. Another sign that you should not ignore, which is number 8, is when you have vaginal bleeding. This one, everybody knows it, that as soon as they see a tiny bleed from the vagina, there is something absolutely wrong. Now, it's something everyone knows, but sometimes people think that, okay, this is just a tiny blood, like he just wants that the blood came and it stopped. Go and see your doctor. Even if it's when I mean the tiniest drop that comes out of your vagina, go and see the doctor. There are so many things that can cause this to happen. You're pregnant, you're not meant to be seeing blood from your blood is not meant to be coming from your vagina, at least for the next 9 months. You're not meant to have any blood coming from your vagina. The only time blood needs to come out from your vagina is when you're pushing the baby out. But please, if you notice any form of bleeding, as soon as possible, don't joke with your health. Go and see the doctor. Another sign that you should not ignore is when you're having a leak from your vagina. Now, this is when, especially when you're in your 3rd trimester, there are some people that have actually not don't know when their water breaks, especially when the water breaks and it start leaking like bit by bit, not the one that just burst out that is so obvious that, okay, your water has broken. Some people, their water just break and it starts leaking slowly. If you notice that leak, abnormal leak, you know you're not weeing, you know you're not incontinent, but you can just see that your knickers are getting wet and wet. Know that maybe your water has broken, and you know when your water is broken, your baby needs to get out of your tummy. So it's very, very important that as soon as you notice that, you observe that, you need to go see your doctor as soon as possible. Another sign that you should not ignore is when you suddenly become very thirsty. Like very, very thirsty. Pregnancy itself can make you get dehydrated, don't get me wrong, but you would know when all of a sudden you get so thirsty, like even when you drink, you're drinking a lot of water, you're still feeling that you're very thirsty. That might be one thing, and that could be gestational diabetes. You don't want that. So as soon as you notice that this very, very strong thirst, and very strong urge to wee like all the time, obviously if you're drinking, you're going to be weeing. But if you notice that in as much as you're drinking a lot, you're still feeling very thirsty, you're still feeling very dehydrated, please go and see the doctor. You might be having gestational diabetes, or you might not, it might even be nothing, but let the doctor tell you that it's nothing. Let me not tell you it's nothing. Let your husband not tell you it's nothing. Let your mom not tell you it's nothing. Let people not tell you it's nothing. Let the person who is trained professionally tell you that it's nothing. Then you can have that peace of mind. Another sign that you should not ignore is when you have that burning sensation when you go to wee. If you've experienced urinary tract infection before, you would know that as soon as you go to the toilet to go and wee, at the end of the wee, yes, this very tingly, this painful, or this kind of burning sensation that you get when you're weeing. So whenever you notice that, it can only be one thing: UTI. UTI will not go on its own. You have to ring the doctors so they give you antibiotics. So don't let it stay, because obviously infection is not something you want to have when you're pregnant. You have pregnancy going on with you, right? You don't want to add any other thing with it. So whenever you notice that burning sensation, go and get checked, so you'll be given some antibiotics and it's going to be taken care of as soon as possible. Another sign that you should not ignore is when you're vomiting all the time. Right, so first trimester, most of the times people go have that period when they are vomiting, having nausea and all of that. But when you've gone past your first trimester, you're in your second trimester, you're still vomiting, you're in your third trimester, as if something is not right, you may want to see your doctor as soon as possible, because vomiting itself, you can imagine when you're not pregnant, you vomit. You know, when you vomit, as soon as you finish being sick, you are really tired. Then imagine someone having to go through that like 7, 8, 9 times a day. It's a lot of exhaustion. You're going to be really exhausted. So see the doctor, see your midwife, and let them tell you what you need to do. Another sign that you should not ignore is when you're feeling very dizzy. Like I said on the other point, pregnancy can make you really tired. Pregnancy can make you feel really exhausted. But you know when it's gone past the normal pregnancy tiredness. So one of the things I'm going to say is that know your body. Know your body. You would know when something is getting abnormal, getting out of hand. This is not normal for you anymore. So know your body. As soon as you notice that you start feeling very dizzy, you're eating well, you're eating healthy, everything is fine, especially if you've gone past your first trimester, you're feeling very dizzy, you're feeling very fainty and very lightheaded, please go and see the doctor as soon as possible. Go and see the doctor and get yourself checked. Another one that you should never ever ignore is when you notice that your baby has stopped moving. When you notice that the movement of your baby has either reduced or has stopped. Me personally, let me tell you what I do when I'm pregnant, because I try to observe how my baby moves. If you're very observant, you would know the times how your baby moves, different responses and all of that. So I know the things that make my baby move. I know the things that I can do that will make my baby move. I can drink hot water, like hot tea, or maybe drink something with either very cold temperature or very hot temperature, or when I have a shower, or when I lie down in an awkward position. There are so many things that you can actually do to actually like observe the baby movement. But when you do all these things and you observe that your baby is just not moving, the next car should be straight in fact, don't even wait to the point where your baby is not moving anymore. As soon as you observe reduced movement, straight to the hospital. Like rush straight to the hospital. There's no even time to wait. There's no time to sit down and say, let me observe for another 5 minutes, or let me observe for another 10 minutes. Straight to the hospital. Like straight to the hospital is very important. Another sign that you should not ignore is ignoring all the signs, which is the number 15. Ignoring everything that I've told you. Now, as someone who is very observant, who knows, obviously you know your body, because you've been following me on my channel and I've been talking to you guys, encouraging you on how you should understand your body, know what is going on in your body. So I know that you know your body. Know what is abnormal. Let me tell you something. Like I said in the beginning of this video, we are responsible for our health. If you notice anything that is not normal, even if I have not listed it, even if it's not on my list of what you should not ignore, but you know, you have that instinct, something is telling you that this thing is not normal. You don't have to discuss it with a lot of people. You don't have to discuss it maybe discuss with your partner. Your partner says you hang. You know yourself. You know that something is not right. Please go to the doctors. You don't have to say, okay, let me wait until morning. Go that time you observe that something is not right to the doctors. So these are the signs that I have personally gathered from my reading, from the pregnancy notes that my midwife gave to me, and the pregnancy notes that I've read online. These are all the signs that you should not ignore when you're pregnant. Do you have any sign that you think women should not ignore or families should not ignore when they're pregnant? Let me know on the comment section. But for now, can I just encourage you that you are strong. Your body is built to carry this pregnancy, and I wish you the very, very best through your journey or through this period of you being pregnant. So thank you so much for watching this video. If you enjoyed this video and you have not subscribed to my channel, please press the subscribe button and the notification bell, because I'm going to be posting a lot of pregnancy video or pregnancy related video, because I am pregnant myself. So we are on this journey together. So thank you so much for watching. Be grateful, be positive, and be yourself. See you on my next video.